Good morning, Las Vegas, and welcome to A Healthier Tomorrow. I'm your host, Will Rucker. I am so glad that you have joined me for this morning's broadcast. You are truly in for a treat. Our guest today, just dynamic. Wait till you hear the information that we have to share. A Healthier Tomorrow is an outreach program of Community Partners for Better Health. Visit us online at www.cpbhlv.org. Let your family, your friends, your neighbors know that A Healthier Tomorrow is on the air right now and that they should tune in. A Healthier Tomorrow is brought to you by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. There is no better time than now to breathe easy and live smoke-free. Finding a place to call home is hard, but finding a smoke-free apartment can be even harder if you don't know where to look. We have over 60,000 smoke-free apartments right here in Southern Nevada, and they are listed in the smoke-free housing directory. To search the directory, visit gethealthyclarkcounty.org and click on the smoke-free housing icon. I would now like to welcome our very special guest. I am so excited for you to hear from this individual. You're going to be so blessed by what he shares. Reverend Jermine Alberty, welcome to A Healthier Tomorrow. Good morning.
It is good to be here. Thank you so much.
You're relatively new to Las Vegas, so for those that may not know you, would you please just share a little bit of information about who you are and the work you are doing?
Absolutely. Native of Kansas City, Missouri. Family and I moved here about 2 years ago. And I'm a national trainer for a program called Mental Health First Aid. I've been doing that for 13 years as one of the founding trainers, but also the executive director of Pathways to Promise, a national nonprofit that helps faith communities create mental health wellness programs. A whole lot of other things I could say, but I think my most important title at this point is Grandpa or Peepaw.
Nice.
My granddaughter is 7 months old, so that's the newest title that I cherish the most, is being her Peepaw. So,
congratulations on that. I know that's so special. So, for those that don't know what mental health is, just break it down for us. We're going to get into all of the work that you do, but let's set that foundation and just talk about what it is.
Yeah, mental health is health. And I think it's important to distinguish that mental health is health. It is part of our whole being. And so sometimes we take health and we segment it, physical, spiritual, but mental health is part of our emotional well-being. But I think if anything that I said matters most is that mental health is health.
Yes, I agree. That's a great way to frame that and to make it more universal, because, I don't know about your church background, Reverend, but mine is we pray, we might talk to the pastor a little bit, but we don't have mental health issues because we're saved. So I'm glad that you are in this field and sharing that information and knowledge. What is mental health first aid?
Mental health first aid is a 8-hour training in person, also offered virtually. But what it does is it helps the individual be able to identify and recognize signs and symptoms, and to provide assistance for persons who may be in a non-crisis or crisis situation. So if a person is experiencing suicidal thoughts or behavior, or if a person has had some kind of traumatic experience or panic attacks, Mental Health First Aid teaches a 5-step action plan that equips you to help that person. Until professional help is able to be received by that individual.
So is this something that anyone can be trained, so other faith leaders as well as just members of congregations?
Absolutely. Mental Health First Aid is a general public training. We've trained everybody from teachers to counselor to law enforcement to fighters to physician assistants. So professional and non-professionals most definitely can take advantage of Mental Health First Aid. It's designed for the layperson who has a desire to assist someone, just like if they were trained in physical first aid.
That makes sense. So how did you get involved with mental health in general, but also with this practice?
Uh, I believe in divine patterns, and I came to this work. I can't believe it's been almost 17 years ago. I left a position in doing community organizing, was looking for some work, and all of a sudden saw on the paper a position to do training for a mental health community center, a mental health, should I say, mental health organization, and that provided direct service to individuals. And I applied, and that's where the journey began. So almost 17 years ago was this change in life, and never knew it was going to be equipped for me to deal with loved ones who dealt with suicidal thoughts and behaviors, to deal with loved ones who dealt with addictions. Never knew that this was the path that God had for me. But when I tell you, it has equipped me to deal with almost every and anything on my last 17 journey. It's been a blessing that I came into this work.
What you have shared just so far, I think, is going to be a help for our community, because again, sometimes mental health is something we want to shy away from, particularly in our faith community, but also just the Black community in general. We don't think of depression as something that can be real. I know even growing up, people would be like, you don't know what tired is, you're just a kid. And it's like, you don't acknowledge those feelings. So I think it's so important that this information is shared. We're going to take a break and be right back, because I want to hear about your role with NAMI. I want to take a moment and let you know that I am participating in a very special social media campaign called Be Kind 21. And it's just that, the hashtag Be Kind 21. So my act of kindness today is this radio show, is doing this broadcast. I couldn't think of anything more kind than to help people and be empowered to live healthier, more enjoyable, higher quality life. That's the most kind thing I could think of to do. But what's the act of kindness that you're going to do? Take a moment today and just do something kind for someone, a stranger, a loved one, a friend, a neighbor. It doesn't matter who. Do something kind for yourself, and then just post about it on social media using that hashtag BeKind21, so that we can keep track of what is happening. I'm so excited about that and what is happening in our community, because kindness is power. A lot of people say, oh, you're kind and weak. No. Kindness is not weakness. Kindness is strength. All right. So I know you're going to post about Be Kind 21, and we're going to show the world just how kind Las Vegas really, really is. If you haven't already, let everyone know that A Healthier Tomorrow is on the air. I'm your host, Will Rucker, and joining me today is none other than Reverend Jermine Alberty. He is a phenomenal individual who is doing mental health work right here in our community and leading some amazing efforts. So you've already shared with us around mental health first aid. Could you tell us a bit about NAMI and your involvement with that organization?
Yeah, I'm so proud to be a board member of NAMI Nevada. NAMI stands for the National Alliance for Mental Illness. And the way NAMI is set up is a national NAMI, then there's state NAMI organizations, and then there's local organizations. So we have a chapter here in Las Vegas, and I'm on the board of the state NAMI. And NAMI has numerous classes that persons can attend, like family to family. They have peer support programming, as well as a program for African Americans called NAMI Sharing Hope, where you can learn more about mental illness and how you can refer somebody for assistance. So NAMI is a great organization. Also, NAMI is on the forefront of advocating for individuals and families with mental illness at a state level in regards to funding, proper funding for mental health care. So I love NAMI.
Awesome. They're one of my favorite organizations. And so, your involvement, it's just perfect that we were able to encounter one another. I want to shift our attention just a bit to how can someone identify they are having a mental health challenge or experiencing mental illness. What should we be looking out for? How can we identify it in others when they may not see it in themselves? And of course, in addition to the mental health first aid, what can we do for that individual?
Yeah, so we describe a sign as what you see, and it's simply what the person may be experiencing. And so sometimes we see behavior that may be not typical for the person that we are encountering, if it's a loved one, a family member, or a friend. And if you see something that just looks different with that person, maybe they're not sleeping as much as they used to, they may seem to be agitated, they may be having thoughts that are just not typical for them, simply asking one question: are you okay? Now, most time we say that one word: I'm fine. I'm fine. That one word, fine, is what we say to get away from telling the truth of really how we're feeling. But if you're genuinely concerned about that person, say, no, I'm serious. Are you okay? And if they say, let them know this phrase: it's okay not to be okay. We need permission that it's okay not to be okay. You mentioned earlier in the interview about Black folks and depression and so forth. We are a very resilient people, but our resiliency, I think, has caused us to deny not only mental health challenges, but physical health challenges, and have resulted in some really horrible outcomes for our community from a health perspective. Yeah. So just acknowledging that it's okay not to be okay. And if that person says, I'm not okay, that's when you can say, well, have you considered going to your doctor about that? Because the primary care physician could be the first stop to go to make sure it's not something that's going on physical. And then the person...
So before we move past that,
yeah,
I think that's critical. A lot of times I'll hear someone immediately say, well, you need to see a therapist or a counselor. And I'm a big advocate for it. I think even if you're doing okay, you should still have a regular check-in. Absolutely. But you're saying you can even recommend them to their primary care, to their doctor that they go see for like their physical.
Yeah, go get a physical so you can make sure there's something going on with you chemically. Because diabetes can cause there to be changes in emotions and behaviors and mood. So it could be hypertension could cause changes in behaviors and moods. That doctor may then do a depression screening and encourage that person to go see a therapist or a counselor. Because the stigma, which I like to talk about, stigma is like a stigmatism. It blurs our perception and our view of people. So oftentimes that stigmatism that blurs our view is rooted in bias and prejudice. So some folks, if you say see a therapist or a counselor, they'll be like, I'm not going to see a therapist. I'm not going to any counselor. But just to see a doctor to make sure that you're physically well, that could lead to hopefully you seeking out something for your mental health. Because it's all about well-being. I want us to think about our whole body. Not just this separate kind of idea of mental health alone, but mental health, physical health, spiritual health. We want to be healthy, whole beings.
Yeah, that's so good. And you're absolutely right about that stigma piece. What I would add on that is if you do see a counselor or a therapist and it doesn't work out, that's okay too. There are others. You don't have to stay with the first one. Just like your primary care physician, you may not gel with that person. Or heck, your first date, the first person you dated, you didn't marry them. So why do you think you have to marry your therapist in that way? Thank you so much for sharing that. What are some things we as a community can do in addition to asking that question, are you okay? What are some things we can do to help improve the state of our mental health and our overall well-being?
Yeah, 2 words: self-care. I think just self-care is so important, that we are going for walks, that we are meditating, that we are praying, that we do something that can alleviate stress and anxiety. So it's real simple, take care of yourself, but it's so hard.
It is very hard. So why don't people invest that time in actually taking care of themselves?
I think that we've been trained as a society that you have to be busy. And I think we have to learn how to slow down and just enjoy life. But I think we've been programmed that if we're not busy, then we're not successful. We're not busy, then we're not doing. And it's important to slow down. And I had an epiphany. When was the last time I breathed? And I thought, well, that's a silly question. I'm breathing right now. No, when was the last time you stopped, took in a deep breath, and exhale? So that's what we want to encourage folks to do. Just stop. Just stop. Inhale and exhale. So I would say we want to encourage folks to take care of themselves, and then we want to encourage each other to take care of one another. And if we can do that as a community, I think we have some good things going.
Awesome. In our last few minutes together, you brought up one thing I did want to touch on, which is taking care of each other and companionship. Can you share a little bit about that project?
Love to. Companionship is our response to someone who may be in distress or suffering. It is truly a practice of presence, rooted in 5 practices: hospitality. How do you create a safe space for one another? Neighboring. How do you set aside your privilege and your power and all that and just be human with one another? Side by side. How do I come alongside you, not pushing you, not prodding you, but walking with you? And how do I listen to your story? Not my story, your story. And then lastly, as community, how do we build a circle of care to support one another? There's more info about that at the companionshipmovement.org. If they want to learn more about the companionship movement, it's part of Pathways of Promise. And so, yeah, I would invite folks to come learn more about that. Companionship is a wonderful movement. If I must say so myself, it's a wonderful movement.
And I love it. I think that our relational health is critical to our overall well-being. And so many people, particularly here in Las Vegas, are so very lonely that anyone that's promoting healthy relationships, I'm going to promote them and amplify their message as much as possible, because it is so critical that we learn how to be human together.
Absolutely. I think the more we understand that we truly, genuinely need each other to survive and to thrive, the better we become as a community.
Made me think of that Hezekiah Walker song, "I Need You to Survive."
I know, it came to me too when I was saying it. I just think that we have become so caught up in the individual that we neglect the collective. And when they used to say it takes a village to raise a child, it takes a village to really thrive. And that makes for good mental health.
Indeed. Well, Reverend Jermine Alberty, thank you so much for joining us this morning on A Healthier Tomorrow for this conversation on mental health. How do people connect with the work that you're doing?
Folks can email me at jalberty, that's ALBERTY, at pathways2promise.org. And they can also visit my website at jerminealberty.com. That's Jermine without an A. So it's JERMINE Alberty.com.
Perfect. Thank you again. And we will see you back here on A Healthier Tomorrow real soon.
Thank you so much.
The A Healthier Tomorrow radio program is sponsored by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. September is National Childhood Obesity Awareness Month. Obesity puts kids at risk for health problems that were once only seen in adults, like type 2 diabetes, high blood pressure, and even heart disease. The good news: childhood obesity can be prevented. To learn more, visit www.gethealthyclarkcounty.org. Again, that is www.gethealthyclarkcounty.org. All right. And with that, I would like to welcome our next guest, none other than Dinishia Mingo of MHS Behavioral Services, Mingo Health Solutions. I'm just so excited to have her on the program this morning. Welcome to A Healthier Tomorrow.
Thank you so much, Mr. Rucker. It's a pleasure to be here.
Absolutely. So glad you're here. Now, for those who may not know you, and I can't imagine it's too many folks, but for those who don't know you, could you share a little bit about who you are and the work you are doing in our community?
Yeah, so I'm actually a Las Vegas native. I always like to tell people that because I'm proud. I joke, say second generation. My mom was born here, grew up in North Las Vegas, moved to the east side, then moved to Henderson. So I've been all around, went to ATEC. And so currently, as you mentioned, I'm the owner of Mingo Health Solutions, that many people may know as MHS Behavioral Services, where we do counseling and therapy services for all ages. Our specialties include trauma, crisis, and behavior intervention, but we work with most diagnoses and we just place people, appropriately with the correct therapist. We also do services for kids with autism, training, and a lot of community awareness events. And I'm just thankful to be the CEO of it. Also, I'm the founder of Solutions of Change, which is a nonprofit organization. I think it'll actually be applicable later in the show as we continue the dialogue, but it currently provides free counseling and therapy for those who are uninsured, underinsured, and undocumented.
Oh my goodness. Well, let's just dive right into that, because I know that our listening audience understands that mental health is important. We talked about that with our previous guest and kind of dispelled some of that stigma around it. But there's still that barrier of entry with costs and it being, frankly, expensive in most instances. So tell us about how you're able to provide that free of charge.
Well, so currently we have a grant and we have been doing fundraising. So it is expensive. And I just try to encourage people to know that, just like you go to the doctor, the people who are treating them are qualified therapists who have master's degrees and they're licensed in their profession. I'm not a therapist. A lot of people think that I am. My master's is in educational psychology, and I'll actually be starting my PhD this fall. But I know that cost has been a barrier, specifically for our community. A lot of my work prior to starting MHS was doing outpatient rehabilitative mental health services. So I was in the homes, in the community, working with people of all ages. And I just knew that there are so many barriers around requirements for treatment, what it has to look like. And it really limits us, I feel, to be able to render what's needed for our community. And so that was really why I started Solutions of Change. I was like, I don't want cost to be a barrier, and I don't want to be limited by what insurance says is effective, because a lot of times what's deemed as effective is not really culturally sensitive to the needs. And especially when we're talking about people who can't afford it, they have so many other barriers and needs that have to be met that oftentimes insurances don't authorize. So we founded Solutions of Change for that reason, and it had kind of just been sitting there. And I was doing some outreach events called Healing to Health, bringing the dialogue of mental health to the faith-based community, actually. And we had done a few of those, some suicide events. And then finally last year, we were able to get this grant, which is so important. So our mental health block grant that we have, which we will be renewed, currently offers free counseling to youth and families. So if they've experienced any type of trauma, and it doesn't have to be, the severe ends of trauma, just any type, and there's a youth connected, now not only that child can access free counseling therapy, but their parents can. And so it doesn't have to be just family counseling. We can give the immediate family, siblings, whoever is that in that immediate family in the household, counseling, individual, couples, whatever is going to be needed to improve that environment for that child. And in addition, we offer family services and resources and crisis intervention. And that's important because going back to when we talk about the cost and the barriers, a lot of times the stressors that many of the people that we serve are related to housing needs and food needs and just a lot of other financial barriers. So we want to make sure we can provide the therapeutic treatment with the understanding of Maslow's hierarchy of needs, that they got some other needs too that need to be met.
Wow. So I'm just buzzing because that is such a vital need in our community. And the way that you're going about it is brilliant. Like, I'm just sitting here like, whoa. One thing you mentioned is around that trauma piece. And I can tell you, as a person that's been in ministry for now 20 years, I've yet to meet a person that has not experienced trauma or is not experiencing trauma. Mm-hmm. Amplify that 10 times with COVID-19 still raging in our community, hitting African Americans and people of color at a disproportionate rate. And the way that we experience the trauma, because we already were disadvantaged in so many ways, but now we have this added layer. But you provide a solution of change. So thank you so much for sharing that. I know our audience is going to want to know how to get involved and to take advantage of this opportunity. So how do they reach out and get connected?
They can call 702-848-1696. Again, that is 702-848-1696. If they call that number, they can access both MHS and Solutions of Change. So we make sure the organizations work together because, again, the combating the stigma and breaking the barriers is to make sure that we can connect people as easily as possible. So if they are not eligible for MHS, then we will refer them to Solutions of Change. If they're not eligible for Solutions of Change, we'll refer them to MHS or anybody else. We keep our own resource list as well because we just want to help people. They can also visit our website at mhsbehavioralservices.com or solutionsofchange.org.
Nice. Solutionsofchange.org is where I'm going to go. And I don't know if y'all have a donate button, but I'm going to hit it when I see it. So congratulations on your success in pursuing your PhD. Like, I want our audience to know, for those that are listening, this is a woman of color. And she is doing this, leading this behavioral health movement where we are really taking a holistic approach to our health and healing some things we probably should have been healing a long time ago, but didn't know what we didn't know. So congratulations on that. And thank you for your service. Is there anything you want to leave with our audience? If you have one thing that they can take away, what might that be?
I think that right now we just need to be encouraged that we don't have to go through it alone. I think as a people, we are so used to being resilient and figuring things out. And over the last year and a half, the number of minorities, particularly African-American people who have reached out to us to access help has skyrocketed, so much so that I have had to purposefully hire more African-American therapists, which is a great thing. That means we're reaching out. And I was asked, well, what do you think the difference is? And I think that for the first time ever, everybody was going through something at the same time and going through the same thing. And I think that gave people permission to finally speak up. And once they came in there, they thought they were stressed about the job loss or grief to maybe a family member being lost or being stuck in the house or kids. But like you said, all those other layers began to come out. So I just want to encourage us to know, I always say you're not alone, but really to know you don't have to, and you're not meant to go through it alone. And it is absolutely okay to get professional support, whether you're dealing with something serious or just a small, minor life change. We need a village. So we're here.
Wonderful. Thank you for joining the show. And I believe in connecting people with great resources. You are not just operating the behavioral health business. You also have your own, is it a podcast? What's going on? Because I know I've been seeing flyers about it.
Yeah, so actually, I appreciate you. Once a month, Commissioner McCurdy and myself are having a Mental Health Mondays with McCurdy and Mingo, and that is a part of his Keeping Up with McCurdy podcast. People can find that on Spotify, Apple Music, Google. We are also on Facebook. And so I'm just thankful for people such as yourself and Commissioner McCurdy to allow me to do what I love to do, which is spread awareness and connect people to help and treatment. And this month is a Suicide Awareness Month, and National Suicide Prevention Week and World Suicide Awareness Day. So we will be talking about suicide on our podcast this month.
Awesome. Well, y'all check that podcast out. I already know it's dynamic. I'm going to subscribe myself and listen while I'm working out.
I appreciate you. Wishing everybody well, sending prayers and wishes of healing everyone's way.
All right. Well, that is our show for today. This has been A Healthier Tomorrow. I am your host, Will Rucker. And I just want to remind you, you are not a drop in the ocean. No, you are the entire ocean in a drop. And what you do matters. So live compassionately. We don't just take care of ourselves because we're selfish and self-centered. We couldn't survive that way. We take care of ourselves so that we can be an active participant in this body, this community we call Las Vegas, and hey, the world as a whole. So thank you again for tuning in. I will see you again next month on A Healthier Tomorrow.